She stands in front of the freezer section for longer than she usually would. She has been managing her blood sugar carefully for 2 years, reading labels, watching portions, making the disciplined choices her doctor encouraged. She reaches past the regular ice cream and picks up the one labeled, "No sugar added," satisfied with herself. She does not know that what she just put in her cart may be doing more to her blood sugar than the regular version she walked past. And no one has ever explained why. Navigating food choices with diabetes or pre-diabetes after 60 is genuinely difficult. And one of the reasons it is difficult is that the food marketing system and the medical system speak different languages. Nutrition labels emphasize what has been removed: sugar, fat, sodium, without clearly communicating what has been added in its place, or what the net effect on blood glucose actually is. Most appointments do not have room to review specific products, and so, older adults making careful, conscientious choices at the grocery store are regularly choosing foods that undermine the very goals they are trying to support, not because they are careless, but because they have not been given the specific information they need. My name is Dr. Noris. I am an endocrinologist and diabetes specialist with 19 years of clinical experience, focused specifically on blood sugar management and metabolic health in adults over 60. What motivated this video is the number of patients who arrive at follow-up appointments with blood sugar numbers that do not match their reported diet, and whose freezers, when we talk through what they actually eat, are full of products they chose specifically because they thought they were safe. After 60, blood sugar regulation becomes more fragile for reasons that are physiological rather than personal. The pancreatic beta cells that produce insulin lose functional capacity gradually with age. Insulin sensitivity decreases, meaning the body's tissues respond less efficiently to the insulin that is produced, requiring more of it to achieve the same glucose clearance. The kidneys become less efficient at excreting excess glucose, and the liver's tendency to release stored glucose overnight increases, contributing to higher fasting readings. Think of the blood sugar management system as a team of workers that has been running the same shift for 60 years. The equipment is a little worn, the communication is a little slower, and the margin for error has narrowed. In this environment, even moderate glycemic excursions, blood sugar spikes that might have been corrected quickly at 40, take longer to resolve and leave more metabolic disruption in their wake. The choices that matter most are precisely the ones that seem small and safe, and are not. Before I walk through what I want you to know about choosing ice cream as a person over 60 managing blood sugar, I want to ask you something. Do you currently eat ice cream or frozen desserts at home? Occasionally, regularly, or not at all? Just type one of those in the comments. I want to understand what this community is actually doing. The first thing most seniors get wrong about ice cream selection is treating no sugar added as equivalent to low glycemic or diabetes safe. No sugar added is a manufacturing claim. It means that no sugar was added during the production process. It does not mean the product contains no sugar. The dairy base of ice cream naturally contains lactose, a sugar, and depending on the other ingredients, the total carbohydrate load of a no sugar added ice cream can be nearly as high as a standard product. More significantly, many no sugar added products replace sucrose with sugar alcohols. Ingredients like maltitol, sorbitol, or xylitol that are marketed as non-glycemic, but that in practice cause meaningful blood sugar rises in many people over 60, particularly in those with reduced insulin sensitivity. Maltitol in particular, which is one of the most commonly used sugar alcohols in frozen desserts, has a glycemic index that clinical data suggest is approximately half that of regular sugar. Not negligible, especially when consumed in the portion sizes most people use. A woman named Harriet, a former court reporter with a meticulous eye for precision in language, came to see me baffled by fasting blood sugar readings that remained elevated despite what she described as strict dietary discipline. When we reviewed her actual food log, her evening snack was regularly a serving of no sugar added vanilla ice cream she had chosen specifically for its label. Switching to a small portion of a full-fat, lower carbohydrate alternative, chosen for total net carbohydrates rather than the marketing claim, produced a measurable improvement in her morning readings within 3 weeks. The practical fix: read the total carbohydrate and total sugar alcohol content on any frozen dessert, not just the front label claim. Net carbohydrates, total carbohydrates minus fiber and sugar alcohols, give a more accurate picture of glycemic impact than the absence of added sugar alone. The second mistake is choosing low-fat or fat-free ice cream under the assumption that lower fat means better for blood sugar. This is one of the most persistent nutrition misconceptions of the past 4 decades, and it is especially consequential for people managing glucose. When fat is removed from a food product, something must replace it to maintain texture and palatability. In frozen desserts, that replacement is almost always additional sugar, modified starch, or other carbohydrate-based thickeners. The result is a product that is lower in fat, but higher in rapidly digested carbohydrates than the full-fat version, meaning it produces a faster and higher blood sugar spike. After 60, with reduced insulin response capacity and slower glucose clearance, that faster spike translates to a longer recovery period and greater glycemic disruption. A man named Clement, a former weather station operator who had spent his career tracking precise measurements and who brought that same precision to his health management, came to see me having switched entirely to fat-free frozen yogurt as a dessert after reading that dairy fat was something to minimize. His blood sugar logs showed consistent post-dinner elevations that had not been present before the switch. The fat-free yogurt contained 12 grams more carbohydrate per serving than the full-fat version he had been using. Returning to the full-fat version in a smaller portion resolved the post-dinner elevations. The practical fix. Compare the total carbohydrate content of full-fat and low-fat versions of the same frozen dessert before choosing. In many cases, the full-fat version, eaten in a mindful portion, will produce a lower blood sugar response than the low-fat version eaten in the same or larger amount. The third mistake involves the timing of ice cream consumption, specifically the common habit of eating it as a late evening snack after dinner and close to bedtime. The glucose from any food, including frozen desserts, enters the bloodstream within 30 to 90 minutes of consumption. If that glucose load arrives in the bloodstream at 9 or 10 at night, the body's ability to clear it is working against 2 disadvantages. Physical activity is essentially 0 for the remainder of the night, which means no glucose is being drawn into muscle tissue through movement, and the overnight liver glucose release that increases with age adds to the already elevated blood sugar load. The combination produces elevated glucose through the early hours of sleep and contributes to high fasting readings in the morning, which is the exact number that most doctors use to assess how well blood sugar is controlled. The reading that feels most mysterious is often the one most directly explained by what was eaten 2 to 3 hours before sleep. A woman named Celestine, a former concert violinist who had a lifelong habit of a late dessert after her evening practice session, a ritual she had maintained for 40 years and that felt entirely non-negotiable, came to see me with fasting blood sugar readings that puzzled both of us, given her otherwise disciplined management. When we mapped her eating timeline against her glucose readings, the late ice cream snack was the consistent preceding event. Moving the dessert to immediately after dinner, at 6 rather than 9, with the same portion size and the same product, produced a meaningful drop in her fasting readings within 2 weeks. The practical fix. If you eat frozen desserts, eat them as part of or immediately after the main meal, rather than as a late standalone snack. Earlier timing allows some physical activity to follow, improves the body's glucose clearance window, and reduces the overlap with overnight liver glucose release. If you are still with me and finding this useful, type the word dessert in the comments right now. It tells me who is staying through and helps this information reach others who need it. The fourth mistake is portion size, not in the abstract sense of eating too much, but in the very specific sense of treating a serving as whatever fits comfortably in a bowl. Ice cream portion sizes on nutrition labels are typically half a cup, roughly a small scoop. What most people serve themselves at home is closer to 1 cup or more. For someone over 60 with reduced insulin sensitivity, doubling the stated serving size doubles the carbohydrate load and more than doubles the glycemic impact, because the body's clearing capacity is already near its comfortable threshold at the stated serving. The blood sugar spike from a full cup may be disproportionately larger than twice the spike from a half cup, not proportional to it. A man named Sigurd, a former boat builder whose hands were his instruments and whose physical life had always been demanding, came to see me genuinely mystified that his blood sugar numbers were inconsistent in ways that did not seem to track with what he was eating. we introduced a food scale into his routine for 2 weeks, the gap between his reported portions and his actual portions appeared. His standard ice cream serving was consistently 2.5 to 3 times the stated serving on the label. Reducing to an actual half-cup serving and measuring it for a month produced the most significant change in his glucose readings of anything we had tried. The practical fix: measure your ice cream portion once, with an actual measuring cup, and look at what a half cup is. Then make a conscious decision about what portion you want to eat, based on accurate information, rather than visual estimation. The fifth mistake is choosing ice cream labeled diabetic or specifically formulated for diabetics, without reading the ingredient and carbohydrate information as carefully as any other product. Products marketed specifically at people with diabetes or marketed at health food stores under wellness branding are not regulated to a specific glycemic standard. Some of these products are indeed lower in net carbohydrates and more appropriate for people managing blood sugar. Others are simply standard ice cream in packaging that uses health-adjacent language to command a higher price point. The term diabetic on a food product is not a glycemic certification. It is a marketing category. A woman named Ingrid, a former museum archivist who trusted institutional labels and applied that same trust to product labels, had been buying a premium brand of frozen dessert specifically because it was sold in a health food store and carried language about being appropriate for people watching their sugar. The total carbohydrate content per serving was higher than a standard grocery store vanilla ice cream. Her blood sugar did not distinguish between the two. When we replaced it with a product chosen purely on total net carbohydrate content per serving, regardless of the front label claims, her post-meal glucose readings improved. The practical fix: ignore the front label health claims on any frozen dessert entirely. Turn the package over and evaluate it solely on total carbohydrates, fiber, sugar alcohols, and net carbohydrates per serving. That information, not the marketing language, is what determines what the product will do to your blood sugar. Here is what I want you to do the next time you are standing in front of the freezer section. Ignore the front of the package entirely on your first pass. The claims, the colors, the language about sugar and health. Turn every product you are considering over and look at 3 numbers: total carbohydrates, dietary fiber, and sugar alcohols per serving. Subtract fiber and half the sugar alcohols from total carbohydrates to get your net carbohydrate estimate. Choose the product with the lowest net carbohydrates per serving that you will actually eat in a reasonable portion. Then eat it earlier in the evening rather than at bedtime. Measure your portion and pair it with a small amount of protein if possible, a few nuts, a small amount of cheese, which will slow glucose absorption and blunt the spike. That is the complete decision framework. It takes 30 extra seconds at the store, and for your blood sugar management, those 30 seconds matter. Everything I have shared today is meant to help you have a more specific and more productive conversation with your own physician or diabetes care team, not to replace their guidance. Your medication regimen, your specific glucose targets, and your individual metabolic response all shape what the right choices are for you. Please bring this framework to your next appointment and ask your doctor or dietitian to help you apply it to your specific situation. And if today's conversation has you thinking more carefully about how the foods that seem safe are affecting your blood sugar in ways you have not been tracking, the next topic I want to walk you through is the glycemic impact of common breakfast choices for seniors with pre-diabetes, and which ones are quietly raising fasting glucose before the day has even started.